Hey everyone, it's Dr. Wood, and today we're covering Chapter 12, the enteral routes. So what do we mean when we say enteral? Basically, it means anything using the GI tract. So for instance, if I say oral, that means you're going to be swallowing a drug by mouth. If we say rectal, it basically means you're going to be administering the drug directly into the rectum, either with a suppository or an enema, for instance. We'll go over some examples of these as we go through the slides. Nasogastric, so this would actually be if a patient has a nasogastric tube that is placed into the nose and then sort of snake down into the stomach itself. That's called nasogastric. And so that can be very helpful if a patient cannot take medications by mouth. You can use this as a way to get around that. The patient doesn't have to swallow anything because you can basically place the medication right through the tube there. And you can do this with feeds and different things like that. So a lot of uses for NG tubes. And you can sometimes have a gastric tube being placed here. So this is actually a catheter that would be directly inserted into the stomach wall. This would be typically done by either like a GI doc or a surgeon or someone like that. And so this is good for patients that need maybe long-term access to the stomach. So for instance, if they have some kind of issue where they cannot swallow, maybe they have an issue with the esophagus, anything like that. This is a good long-term way for patients to have access there. So they can put food through there, they can put medication through there, all kinds of things. So important to know for oral administration that patients need to be able to swallow. It may sound kind of silly, but that's basically what it is. Also, keep in mind that not every drug is going to be good for the oral route. You may find that some of them may be too irritating for the stomach. Some drugs may actually be inactivated by stomach acids. That's why you don't see, say, oral insulin, because insulin's a protein, and your stomach likes to degrade proteins just like a hamburger, right? And so this is why it's really important to know which medications can and cannot be given via the oral route. And so that'd be pretty obvious. If it has a tablet or a capsule, chances are it's okay to use. Again, when you're administering it, make sure they're getting the right number of tablets to use there. Normally, we like to keep them from handling it themselves because you can, kind of get, if their hands are not, clean, sometimes you can have some contamination there, things like that. But basically by using the cap, that can kind of get around some of those issues there. Now, remember that if you have a tablet that's scored, this is good because you can divide it up for the correct dosage. So if you ever see someone getting, say, a half tab or 1.5 tab, basically what that means is that the tablet is going to be designed to be able to be split in half. So if you imagine a tablet here, and then I were to have a line down the middle, that's going to be the scoring line, right? So that way you can just kind of snap it in half, and then you can use a half tab. It's really important that you know if a medication cannot be split or crushed, and so there's always going to be a list online that you can look that stuff up. This is important for drugs that are maybe extended release, or if they have like an enteric coating. The problem with this is if you, say for instance, take a long-acting medication, one that's designed to be released, say, over 24 hours, and you split that or you crush it, you can actually find that it releases all the drug at one time, and that can lead to some serious toxicity. If it's enteric coated, that means it's actually designed to get through the stomach acids without being degraded, and then once it gets into the small intestine, that enteric coating will melt away, and then the drug can be absorbed. If you crush that, that means that the drug may not be able to be, may actually get degraded by the stomach acids. So that's really important. Again, if a patient needs a liquid medication, that usually is going to be more of a specialty kind of thing. It's going to be done on a case-by-case basis. Okay. Again, make sure not to touch the medication directly. Again, you want to contaminate it, and then and if you need to, just go ahead and transfer the drug to like a medicine cup or something that they can use to just take that directly. Now, typically what we'll do is then when you're using the medication to kind of assist with swallowing, make sure they're placing it towards the back of the tongue. That can help out with that. One thing to note that I didn't know when I was in school until kind of later on in life was that tablets tend to sink in water, so it's better to place those on the back of the tongue. Capsules tend to float, and so what that means is that sometimes patients have a hard time swallowing it because it's kind of floating to the roof of the mouth. If you have them kind of look down and kind of point their heads down, that will allow the capsule to kind of float to the back of the throat and will assist with getting that swallowed a little bit more easily. Make sure they're looking at the labels carefully to make sure that they are getting the right medication, because sometimes they have a lot and they can mix them up. And when you're storing oral medications, it's important to make sure to keep them out of extreme environments. So that means no strong light, no high humidity, things like that, and no open air, right? Don't want to keep the medication bottle open. So typically what we'll end up doing, or I'll see patients do, is they'll keep it like, say, sitting on their dash in their car in the middle of Florida summer. And that can have a problem with some drugs and actually degrade them. So you want to prevent that. Notice if the drug is expired, don't use the past expiration date, or if there's any change in color, odor, something off with it, I'd just rather not use it altogether. Okay. Now, some medications can be staining to the teeth. So, for example, using like an iron preparation or something. So, if you need to use a liquid medication that stains like that, go ahead and use it. Take it via straw. That can help to get around that. As I mentioned, split or crush pills only if it's actually indicated, and make sure that's not on the list of things to not crush or chew. Now, say for instance, you have a patient who has a hard time taking capsules of medication. Sometimes what we'll do is we'll open up that capsule and take all the sprinkles and put it into food. This is really important not to put it into hot food because that can actually degrade the medication. And so instead what we'll do is either use applesauce or pudding, and that actually makes it a little bit easier for them. It may help with, say, the palatability. It's good for kids sometimes. However, so you want to make sure they get the entire dose down though. So if you put into a cup of applesauce, they need to get the entire amount of applesauce in, so that way they get the right dose there. Okay. Another thing to note is to never tell kids that the medication is candy. While it may make it more appealing for them in the short term, it also makes it more likely that they're going to take it when they want some candy, and so that can lead to poisonings pretty easily. So just be aware of that. So just say, hey, it's medicines make you feel better. Don't call it candy. Okay. And then be careful if the kid's really upset. It may be difficult to give them medication. It could actually cause aspiration, which means the medication will actually end up going to the respiratory tract instead of the GI tract, and that can actually lead to some lung irritation. So try to have the kid calm and cool before you give it. It may be really tough, but it's something that we try to do. Now with liquid medications, it's important that we use a calibrated either medicine cup or oral dosing syringe. Remember, we've talked about teaspoons and tablespoons, and those are generally not going to be sufficient for our purposes to get an exact dose. And basically what you're going to end up doing is when you pour this into, say, a cup, for instance, you want to go ahead and make sure you read it at the bottom of the meniscus. And what I mean by that would be, I'm going to draw it out for you. Imagine if you have a medicine cup here. Okay, and then you pour your medication in. Basically what you see is that due to hydrogen bonding, you tend to find that the medication itself will kind of have, it'll kind of raise up towards the sides, right here. So if you're wondering, like, where do I read it? Do I read it here, or do I actually read it at the bottom of the meniscus? This is where you want to be reading the actual volume, right at the bottom here. This will give you the most accurate amount of drug that's actually there when you're evaluating that. So one thing to note there. Note that liquid medications are typically going to be used for patients who have difficulty swallowing solids. So kids are probably going to be the most frequent, but also think about patients who have like Parkinson's disease and other things that make it very hard for them to swallow solids. This is where liquids are going to be preferred there. Okay. Also note that if you have medication that gets overpoured, because it may risk contamination, we just recommend not putting it back into the bottle. So that's just one thing to note there. Again, if the patient cannot swallow at all, or if they have a really hard time, if they have like dysphagia, which is a difficulty swallowing, that they are also an aspiration risk, and so that may be someone to avoid that as well. That would be something where you'd want to switch over and use like a parenteral drug potentially. So if you're using an oral syringe, it's important that you go ahead and pour the medication out into a cup usually, and then you use the syringe to draw it up to the correct amount. And then usually you will squirt the medication into the patient's mouth pretty slowly. You may do it kind of in little fits and starts, so kind of do like an ml here, an ml there. You get the total dose in. And then when you're done, this is really important to make sure you wash and dry the syringe, especially at home use. Mainly because a lot of those liquid medications contain high amounts of sugar, and if you don't clean them, they'll get kind of sticky and gross, and then bacteria can also grow on them. So that's something to note. And then in the hospital setting or in the clinic setting, we'll typically just throw them out once we're done and just use a brand new one afterwards. So switching over to rectal administration of medications, typically this will either come in the form of a suppository, an enema, or an ointment potentially. And so some of the benefits of rectal administration include you get really rapid absorption into the bloodstream. You also find that it bypasses the liver, so you get a lot of it into the system all at once. And so we can use it either to get systemic effects, meaning throughout the body, or we can use it for more local effects, meaning right there in the rectum itself. And so for instance, if I have a patient with, say, ulcerative colitis and they have inflammation of the rectum, then I can actually end up using medication right there in the rectum for local effect, versus if I need to get something more systemic, some other drugs will be used via that route for that same purpose. And again, this is good for patients who may be not able to take anything orally, maybe because they're having a lot of nausea and vomiting. This could be a good route for them. Now, suppositories themselves typically, and you can see some examples of suppositories here, they typically either come in a glycerin or a cocoa butter base. They're designed to melt at body temperature, but not at room temperature, right? Otherwise, it'd be kind of a big mess if they melted at room temperature. This is another one you definitely don't want to leave on your dash in the middle of Florida summer for sure, because otherwise they will melt. But basically, when they're placed into the rectum, they will then melt, and then they'll then be able to be absorbed pretty easily at that point. So keep them cool, not put them in the fridge, but certainly just go ahead and keep them, at room temperature. And then note here that they are rounded at the end to prevent any kind of trauma to the rectal mucosa. And then always make sure to take off that foil there, right? Again, it may sound super common sense, but a lot of people actually don't have common sense. And so this may actually cause rectal trauma if that foil is inserted into the rectum. Now, when you're using a suppository, basically you want to first place the patient to a Sims position, and what that means is basically you're going to have them laying on their left side, and then they'll have one leg kind of draped over the other, and this will allow for easier access to the rectum. This is done frequently for things like rectal exams. It's done for drug administration, lots of reasons. And so what we'll do is we'll go ahead and remove the wrapper. We'll try not to handle the suppository with our hands more than necessary, because it will then start to melt on us, so you don't want to do that. And then sometimes you'll actually find we'll lubricate the end. This is not always done, but sometimes it could either be done with water or like a water-soluble jelly. And then you'll elevate the upper buttocks. You will then, hopefully with a glove, place the suppository past the anal sphincter and into the rectum, about 4 inches or so. This may be less if you're doing like a small child or something like that. And just note, if once you're at that point, you typically it'll stay there on its own. Some kids though, especially like neonates, if you're giving like an acetaminophen suppository, they have a lot of rectal contractions, and they can actually spit it out too early. So sometimes I'll just hold their cheek shut. I've done that for my kids. You may see it done for other pediatric patients. So something to note there. Obviously, if they have a lot of fecal matter, you don't want to place the suppository into the fecal matter because it won't get absorbed all that well. So just note that. And then typically have the patient kind of remain still for 5 to 10 minutes or so, kind of let it do its thing. It'll melt, it'll absorb, and kind of be able to work. Now, enemas are going to be a whole other beast altogether. They're still instilled rectally. However, their main use is to try and soften up hard feces, or trying to relieve fecal impactions. If you need to get things cleared out of the bowel quickly, this is the way to do it. And so some patients will be using this at home for kind of relief of constipation. You may have some patients who are using this to clean out the bowels prior to surgery, things like that. And so here's some examples. Here's one that's mineral oil. This one's actually made of sodium phosphate. A lot of different reasons. Basically, you find that you're putting in hypertonic solutions into the rectum, and that high osmolality is going to cause a lot of water to be rushing into the colon, and that is going to stimulate that stretch, and that leads to the defecation to occurring there. So these work really, really well. They're very good to get rid of that feces. However, maybe they're not great from a compliance standpoint, because some patients just don't like to use these. So how are we going to do this? Well, basically, you're going to place them in the Sims position. You'll go ahead and remove the plastic cap and then lubricate the tip. This is going to help to ease with the insertion there, and have the patient take a nice deep breath. You'll then gently insert the tip into the rectum, and then basically the bottles are nice and flexible, so you're going to roll the bottle up from the bottom until all the medication is basically delivered into the rectum. Okay. Again, you want to go super quick, kind of slowly administer it to the rectum, and then have the patient hold it for at least 5 to 10 minutes or so. They may have to go before then, and that's okay, but typically 5 to 10 minutes will be enough for them to really get full effect out of the medication. So that's it for the enteral section. If you have any questions, let me know, and I'll talk to you soon. Thanks.